All right, we're here at the Butte County Public Health Office with Sandee, Renault, and Chanh, and they are going to talk to us today about the services they provide here for the community. So, Sandee, let's start with you. Just give me your title and what you do here.
Okay, my name is Tu, and my title here is I'm the health educator here. So here, I provide counseling for the young folks or male teens who come in who needs family planning services, the initial things. So if they needed, let's say, condoms, or they needed to come and talk to somebody about STD, then I'll do that and then hand that off to one of the nurses.
And Sandee?
I'm a physician assistant, so I'm the one who actually does the patient care, the physical exams, pap smears, STD checks, wart treatment, vaginitis, bladder infections.
And are you doing male and female?
Both male and female.
Okay. And is there outreach to the community here?
Yes, I forgot to mention, but that's something that I also do. Provide outreach to the community, a lot of street outreach. Try to get into some of the schools, try to do educational presentations, talking to people about STDs, maybe how to prevent and where to come, and basically, coming here to the clinic.
So what other services do you want to talk about now that you provide?
Well, the thing that I'd really like people to understand is that if you are not insured, there's a special subset of Medi-Cal. People who are eligible for Medi-Cal, we see them with their Medi-Cal. But for anyone else who is uninsured, and we're not just talking teenagers, we're talking about 48-year-olds. If you do not have insurance, there's a special program called the Family Pact Program, which pays for limited things, but it would be for birth control, STDs, treatment, pap smears, breast exams, bladder infections, and vaginal infections. That's all it pays for, but that's a big part of healthcare for many people.
Mm-hmm.
So, and then you just come in, we put you on the Family Pack card, and all those things get taken care of. Any birth control method, IUDs, whatever.
How do you...
Even sterilization and tubal ligation are paid for by Family Pack.
Well, in the past, we have been really out there in the South Side community here in Oroville, and providing that down by the parks and stuff. But because of the cutbacks, we haven't been taking our mobile unit out there. But currently, we are still working with some of the church groups that are out there in South Side, where a lot of the African American population is kind of centralized down right there by South Side Oroville, by that community. And we still have a partnership with some of the churches to provide that outreach, to provide that education. We're doing what we can. But if the message is getting out there, it's kind of hard to say. And we would really love to have the African American people to come in, or young folks, whoever needs the service, and even the Hmong community to come in, because.
Yeah. I imagine that would be tough for the Hmong community as well.
Well, we see Hmong patients, we have a Hmong interpreter, we have a Spanish interpreter, we have a large Spanish clientele.
So predict for me, if you can, what would happen to this community if, in fact, you lost the funding for this clinic?
I think
what would
it'd be
we
pretty
see?
Tragic. We'd see a lot of unwanted pregnancies and a lot of people who are sterile as a result of an infection that they didn't know they had, because things like chlamydia are often hidden from the person until they've already done a lot of damage. That's why that routine screening on STDs is really important. People walking around with HIV who didn't know they had it. It'd be a pretty tragic situation.
And Sandee, how long have you been doing this?
35 years.
Wow.
I'm actually one of 10 children. My mother had a baby every 2 years for 20 years. So I did reproductive health.
And thank you to both of you for taking time with me today to get the word out to folks about what the clinic is, where it is, and what it's doing for the community. And let's hope we can get some volunteer educators in here too, and some outreach, and maybe some more funding. Okay?
That would be great.
All right.
Thank you so much.
Thank you
Yes.
both very much.